Good evening, everyone, and welcome. My name is Nicholas Brown. I'm the acting co-CEO and also the COO for Communication and Outreach at the Prince George's County Memorial Library System. Bienvenidos a todos. Mi nombre es Nicolás Brown. Yo soy el co-director de la Biblioteca del Condado de Prince George. And we're super excited to have you all here tonight for a very special program presented by the library and Prince George's County Health Connect. Tonight's program is entitled Preparing for the Unexpected, How to Get Health Insurance, a conversation with families and individuals. We are recording the program so that it's accessible for folks on demand. And thank you to all of you who are joining us live here. Before we get going with the content, I just want to welcome our presenters and introduce them to you. They are Dora Arevalo, Consumer Assistance Manager, Prince George's County Health Connect. Welcome, Dora. And also Melisa Castillo, a certified navigator, also with Prince George's County Health Connect, who will be doing our Spanish presentation. Welcome, Melisa. So why are we here and why is the library involved in this work? Well, the library system has been a partner of Prince George's County Health Connect from the very beginning after the passage of the American Health Care Act, Affordable Health Care Act, excuse me. And as a county-wide institution that helps people get access to information and resources, it's our job to make sure that our neighbors in the county can access the resources that you all need in order to have a healthy life and to be successful in the pursuit of your personal and family goals. So we're really excited to bring access to this information to you tonight, but we've been a part of the grassroots effort coordinated by Prince George's County Health Connect for many years to ensure that as many Prince Georgians as possible can get quality, affordable, or no-cost health insurance to take care of their long-term health situation. So without further ado, I'm going to also acknowledge the Office of Strategic Partnerships and Community Solutions under the Department of Social Services. OSPCS's goal is to foster critical relationships with stakeholders to create greater access to community-based services and resources. And they have provided a huge amount of support to make this event possible tonight. And I just want to emphasize how important this work is. Prince George's County Health Connect has been helping tens of thousands of our neighbors get access to health insurance for the past 10 years. We in Prince George's County are really setting the example for the whole state community in terms of how to ensure that all residents have access to quality navigators who are experts, who are able to address the questions and assist with enrollment regardless of language or cultural background. And there's been a lot of tremendous effort over the years. So we are excited to get into this content tonight. So why health insurance and why now? Well, health insurance is something that can help us all, regardless of our age, regardless of our background or socioeconomic status, to take care of things that might come up, but also to make sure that we can do the preventative work with seeing a general practice doctor or seeing a pediatrician, or making sure that we can get access to care if we get sick with COVID or other illnesses. And it is really an important tool for us to have at our access in order to stay healthy and to be healthy as an overall community, so that we can contribute to our families and our households and the Prince George's County world at large. So it's really important that you have health insurance for a lot of reasons. One of those is there's unexpected events that happen in life. Maybe you come to expect a child and it was not in your plans and it ended up happening. It's important that you can have care for the parents in that situation. Sometimes we all face things and challenges like vehicle accidents or issues in our day jobs or evening jobs or whatever. And health insurance is basically that safety net to make sure that we don't have a barrier to going out, to seeing the urgent care practitioner, to seeing a nurse, to seeing a doctor, to seeing a dentist. And yes, it's about preparedness for emergencies, but there's a lot of preventative work that we can do too, and health insurance facilitates that. So without further ado, I'm going to turn things over to Dora and Melisa, and we'll be going back and forth in English and Spanish. If you have questions, go ahead and throw them in the chat and we'll get to them as soon as we can. And we appreciate you tuning in.
Hello, everyone. As Nicholas said, my name is Dora, and I work with PGC Health Connect. We're going to go through a few slides. If you have any questions, you can either keep them to the end or throw them in the chat box. So, need health insurance? We can definitely help. Next. Okay. So Prince George's County Health Connect is a program of Prince George's County Department of Social Services. Melissa.
Hola, buenas noches a todos. Mi nombre es Melisa Castillo y voy a estar colaborando con Dora Arevalo en la presentación de PG Health Connect, por medio del Departamento de Servicios Sociales.
So we provide education, outreach, and we enroll Maryland residents who need health insurance through Maryland Health Connection, the state's official marketplace.
Nosotros proveemos una educación y ayudamos a los residentes del estado de Maryland a poder obtener un seguro médico por medio del mercado oficial que es Maryland Health Connection.
Okay, who do we serve? We serve residents 18 to 64 of age that may be eligible under the Patient Protection Affordable Care Act, the ACA, and now is our 10th year of implementation or service. Next.
Todos los residentes que estén entre el rango de 18 a 64 años pueden ser elegibles para este programa y este año se cumplen 10 años de la implementación de este programa.
So what you'll learn today. So why having health insurance is important, how to overcome enrollment issues, how to enroll in Medicaid and private health plans, how to choose the best coverage, and how to get discounts and tax credits that lower the cost of private plans.
¿Qué es lo que vamos a aprender el día de hoy? Pues el día de hoy vamos a aprender la importancia de lo que es tener un seguro médico, cómo podemos hacer para poder adquirir un seguro médico, los tipos de planes que tenemos, las coberturas y los tipos de descuentos con la ayuda por medio de ayuda de taxes, de créditos por medio de los taxes para poder adquirir un plan económico.
So this presentation is particularly good for families with mixed households, children and individuals without health coverage, young adults turning 26 who will be dropped from their parents' plans, or individuals who are unsure about their immigration status.
Esta presentación se basa o está dirigida a todas las familias que tengan un núcleo familiar mixto, que pueden ser niños o individuos que no tengan una cobertura médica, adultos jóvenes que lleguen a los 26 años y van a ser próximamente ya estar fuera de los planes de sus padres, o individuos que tengan o cumplan los estratos migratorios.
Next. So how worried, if at all, are you about being able to afford any of these following situations for you and your family? So for example, we do have things that happen, and that's why at the start, Nicholas said that this is how to get covered for the unexpected. Unexpected could be medical bills, health insurance deductibles, transportation costs or gas prices, prescription drug costs, utilities in your home, the premium for health insurance, your mortgage or rent, or food. So this is just a graph illustrating how worried the public is, being in that dark blue, of these following examples that could, be a barrier for you to prioritize what you need, being health insurance or food or rent. So.
Acá les mostramos una gráfica, prácticamente nos dice de qué tan preocupados estamos de poder conseguir ciertas necesidades dentro del núcleo familiar. Por ejemplo, tenemos biles médicos que no esperábamos, pagar un deducible por un seguro médico, pagar por lo que es la gasolina o transportación o los costos de estas, medicamentos y sus costos, entre otras. Y podemos ver pues entre un rango de lo que significa, siendo el azul el más alto, al celeste lo que menos, siendo el azul lo que más nos preocupa, a lo más claro que sería pues lo que menos nos preocupa.
Next. So why buy health insurance? So people feel that you need health insurance because they want healthy behaviors and they want to lead active lives. There are many reasons why to buy health insurance. You know, life is full of surprises. Anything could happen, the unexpected, as we said at the beginning. And part of staying healthy is receiving the essential and preventative services that everyone needs to lead a healthy life.
¿Por qué necesitamos tener un seguro médico? O sea, no estamos siempre planificados para saber lo que puede ocurrir. Entonces, muchas personas piensan de que porque mantenemos una vida saludable, a veces un seguro médico no es necesario, pero como se dijo al inicio de la presentación, siempre es bueno tener en consideración y tomar en cuenta, pues más que todo hablar de lo que es la salud.
Next. So these are the top 5 reasons why you need health coverage. So insurance can seem expensive, but not having it can cost way much more. Being uninsured impacts everyone, not just you. Access to free or low cost preventative care, transitioning to a new career, and improved self-worth. So these are just some of the reasons why it's important to have health coverage. And it all starts with us. So just a few examples.
Acá tenemos las razones más importantes del por qué adquirir un seguro médico. Pues una de las razones más importantes es porque puede ser muy costoso y eso nos puede traer biles que no nos pueden acaparar mucho. Otra razón puede ser el impacto que puede tener en la persona el no tenerlo, tener un acceso como el tener un acceso médico para prever, para cuidado preventivo o también para una transición como persona o para una carrera. Next.
So what is health insurance? Your health insurance protects you from paying the full cost of medical services when injured or sick. And it works the same way your car or home insurance does. You or your employer choose a plan and agree to pay a certain rate premium each month. So that's essentially how a private health plan works.
¿Qué es un seguro médico? Un seguro médico es el que nos ayuda a protegernos a nosotros de poder en el futuro poder tener que hacer costos altos por servicios médicos recibidos o cuando tenemos una herida o cuando nos enfermamos. Y va a trabajar de la misma manera que cuando uno paga o tiene un seguro ya sea de una casa o de un vehículo. Y es de la misma manera que tu empleador te puede ayudar a escoger un plan. Entonces, va a trabajar de la misma. Next.
So what's covered in the health plans offered through the marketplace? So preventative care, doctor visits, hospitalization, emergency care, maternity and newborn care, pediatric care, including dental and vision benefits, prescription drugs, laboratory tests, mental health care, substance use disorder treatment, and much, much more.
¿Qué cubren los planes? Los planes que cubre esto puede ser un cuidado preventivo a las visitas médicas, también cubre lo que son las hospitalizaciones, una atención de emergencia, también cuidado pediátrico, también incluyendo otros beneficios dentales y también de visión. También puede cubrir lo que son los medicamentos o una prescripción médica, pruebas de laboratorio, servicios de salud mental y entre otros y muchos más.
Next. So how to choose between public and private plans. So the main two types of health plans are private and public, meaning private health plans, and the other one that we offer is Medicaid. So public health plans like Medicaid is provided through the government, while private health plans include plans you get through your employer and or the healthcare marketplace like us. You can qualify for Medicaid, but it is based on household size and income. In terms private plans, private plans are they're just like employer-based plans, but through the marketplace, we do offer subsidies. So health insurance navigators can enroll you in both. So that's what we do. And we focus on informing people how each works and which one they qualify for.
¿Cómo podemos elegir entre un plan público y un plan privado? Por medio de Maryland Health Connection hay dos tipos de coberturas que se pueden agarrar, ya sea por un plan privado o por medio del plan público. El plan público es el tipo de seguro, lo que le llamamos Medicaid. Este es proveído directamente por el gobierno, mientras que lo que es el plan privado es usualmente por medio de tu empleador o por el mercado, por algún tipo de por decírselo, aseguranza del mercado, o por medio de Maryland Health Connection. Para poder calificar para el Medicaid, que es por parte del gobierno, este está basado en lo que es el ingreso y también depende de la cantidad de familias que hay en el núcleo familiar. Mientras que el plan privado se va a basar en diferentes aspectos. Ambos pueden ser, una persona puede ser asistida por medio de un navegador. Next.
So the free or low cost coverages, like I mentioned before, are Medicaid, or MCHIP for short, stands for Maryland Children's Health Program. They're both Medicaid, but the MCHIP just was the expansion that the government did on the Medicaid plan. So typically a family of 4 making less than $38,000 a year qualify for the free health coverage. And the same goes for a household size of 1 making less than $18,768 a year. Then we have APTC, which is Advanced Premium Tax Credits. That's the subsidies that I was talking to you in the prior slide. It lowers the cost of the health insurance monthly premium. So for example, if the health plan costs $500, but you qualify for $300 in APTC or subsidy, then you would pay the difference, which would be $200 for that plan. So like I mentioned before, young adults 18 to 34 may be able to receive additional help paying for their monthly health costs thanks to the new state program. There are also cost sharing reductions. These lower the out-of-pocket expenses for the plan, meaning copays, deductibles, or co-insurances, and we'll touch a little on what those mean later on.
La cobertura gratuita o de bajo costo, como se mencionó anteriormente, pues tenemos principalmente lo que es el Medicaid, que es, o el programa de salud infantil de Maryland. Esta cobertura de seguro médico es gratuita o puede ser también de bajo costo para aquellos que están por debajo de un cierto rango de ingresos. Una familia, por ejemplo, de 4 personas con ingresos aproximadamente, por decirlo, de $38,000 al año, califica para un plan de seguro gratuito. Lo mismo puede ocurrir con individuos con un ingreso que sea menor de $18,000 al año. Y como se mencionó anteriormente, también tenemos lo que es el crédito fiscal por prima anticipada. Prácticamente lo que hace es reducir el costo de la prima mensual que una persona tiene que pagar de su seguro médico. Este dinero se puede ahorrar o se va a basar prácticamente en el tamaño del hogar y de sus ingresos. Un ejemplo sería si a una persona no califica para Medicaid, entonces puede aplicar para este crédito fiscal. Y por decirlo, si el seguro médico cuesta un $500, usted puede recibir una ayuda para pagar ese seguro y el gobierno le puede recibir la prima por $300 y usted solamente va a pagar la diferencia. También tenemos lo que es la reducción por costos compartidos. Esto lo que va a hacer es va a disminuir que la persona pague de su bolsillo por gastos tales como los deductibles, ya sean también los coseguros o los copagos. Todas estas reducciones, pues, dependiendo del nivel de plan que se adquiera. Y pues gracias a estos nuevos planes estatales, los adultos jóvenes que están en el rango entre 18 a 34 años pueden recibir una ayuda financiera extra para pagar los costos mensuales de su seguro de salud. Next.
So we have the Young Adult Premium Assistance. For 2023, young adults from 18 to 34 may be eligible to receive additional help to pay their monthly premium due to a new state program. The financial help is in addition to the APTC, the Advanced Premium Tax Credit or Subsidy. So in PG, we have income of, an example, $38,280. The monthly payment could be $158, but with this additional help, it could be only $78. So that would be of someone who's age 30. If you look at that last row, that would be the example. So these additional tax credits are very, very helpful for our young population, and it's something very exciting for everyone.
Tenemos lo que es la asistencia especial para los adultos jóvenes. Eso solo es un poco de información extra sobre el programa estatal de ayuda especial para los adultos jóvenes. Para los planes de salud del 2023, los adultos jóvenes, como habíamos mencionado anteriormente, de las edades de entre 18 y 34 años, pueden recibir una ayuda para pagar los costos mensuales de su seguro médico, gracias al nuevo plan estatal. Abajo podemos observar una gráfica o un cuadro donde nos da un ejemplo de lo que se podría pagar por el plan médico. En el condado de Prince George, por un ingreso aproximadamente de $38,000, una edad, un porcentaje entre el porciento de 30 años, podría pagar $158 por su seguro médico, pero con esta ayuda extra por medio del crédito fiscal podría pagar hasta $78. Next.
So diving into a little bit about family status, immigrant families, there are many immigration statuses that allow someone to qualify for health insurance, such as being lawfully permanent resident or temporary protective status. So if you're someone in your household that is eligible, they should apply. They should go into our offices or call us, and we can determine if the status that they have is eligible to receive coverage and which type of coverages they're eligible to receive. So even if you're not sure what it is that the status that you have, you should contact us so we can apply, fill out that application and get a determination. And we don't need the information for the other family members in the household if they're not applying. Just FYI. Sorry, Melissa, go ahead.
Sí, esta información es para orientarnos un poquito de las con el respecto de las familias inmigrantes o los estatus migratorios. En varios estados, pues, migratorios se permite aplicar para planes de salud, ya sea como una residencia legal permanente o también el estado de protección temporal que le llamamos el TPS. Y pues si alguien dentro del grupo familiar es elegible, puede siempre aplicar y no se le va a pedir ningún tipo de información información migratoria acerca del resto de la familia.
Next. So the only place to get financial help, Maryland Health Connection, along with PGC Health Connect, is the only place where Marylanders can receive financial help to pay for their health plan. 9 out of 10 who enroll get savings, so that's pretty big. And in 2022, the average saved was $289 a month.
El único lugar para poder obtener una ayuda financiera es directamente con Maryland Health Connection, cual es el único lugar donde los residentes de Maryland pueden obtener una ayuda financiera para poder pagar su plan mensual. De hecho, 9 de cada personas que se inscriben en este programa reciben una ayuda. Pueden ahorrar hasta $289 por mes, que en un promedio de su prima mensual, lo cual es excelente. Next.
So when can you apply, or when can Marylanders enroll, not apply? So open enrollment is November 1st through January 15th. So today's the 12th, so it's 3 days away. But I do want to emphasize that Medicaid is year-round. And some of the special enrollment periods are losing your job-based coverage, getting married or divorced, moving to Maryland, COBRA coverage ending, and there are a couple more. And after any of these happen, you do have the 60 days SEP, special enrollment period, that allows you to enroll in case you do enroll out of open enrollment. So starting Monday, for example, if you have any of these life-changing events, you can still enroll in a private plan. Emphasis in that Medicaid is year-round, all year.
¿Cuándo podemos inscribirnos? La inscripción está abierta para lo que son los planes subsidiados privados. La inscripción es abierta empezando desde el 1 de noviembre hasta el 15 de enero. Entonces, tenemos aproximadamente 3 días para hacer las aplicaciones y poder calificar para un seguro médico por medio del plan privado. Me cabe enfatizar de que Medicaid está abierto todo el año. Entonces podemos hacer una aplicación para Medicaid durante todo el año. Y tenemos también los periodos de inscripción especial, que son los 60 días después de que ocurra algún evento en su vida, tales como pueden ser una pérdida de la cobertura de su trabajo por X motivo, ya no están trabajando en el mismo lugar o sus ingresos cambiaron, el casarse o el divorciarse, mudarse del estado de Maryland, o también puede ser por la finalización de la cobertura por medio de COBRA y entre otros más.
So when you're ready to enroll, this is what you'll need to have with you: your photo ID, whether it be a state driver's license issued ID, a government issued ID, social security number, immigration citizenship information. These are only for some residents, and only the people that are applying must have their immigration and citizenship information. Your current pay stubs or W-2, and tax statements if employed, and any policy numbers of other insurances.
Cuando estemos listos para inscribirnos, vamos a requerir o necesitar cierta información. ¿Qué es lo que necesita tener para poder hacer la aplicación? Necesitamos tener una identificación con foto, tener un número de seguro social, la información de migración de ciudadanía para algunos residentes o el tipo de migración, de estatus migratorio que la persona tenga. Necesitamos también lo que son los talones de pago o la declaración de impuestos, que es la W-2, y si en este caso aplicara, y los números de póliza de cualquier otro seguro médico que tuviéramos al momento. Next.
So as I said before, here are the explanations of what deductible is, coinsurance, and copay. So how to understand the components of a private health plan. First, what is a deductible? So to understand the difference between coinsurance and copays, it helps to know about the deductible. So a deductible is a set amount that you pay each year for your health insurance before your plan starts to share the cost of covered services. For example, if you have a $3,000 deductible, that deductible will be broken up into pieces from each doctor's visit before the insurance kicks in fully. So for another example, if you go to the doctor's, you're sick twice a month, those 2 times a month, you would have to pay a small portion of the deductible in order to receive the services. And then once you've met all those $3,000, then the insurance will pay 100%. So a copay is a set amount that you pay for either doctor visits, prescriptions, or other types of care. It does not count towards your deductible. So it doesn't help towards the deductible. And then coinsurance is the percentage of cost you pay after you've met your deductible. This primarily counts for hospitalizations. So the coinsurance does not kick in for small visits. It's usually for major services such as long spans in the hospital and or surgeries or procedures. Melissa.
¿Cómo podemos entender lo que son los componentes de lo que es el seguro plan privado? Primero tenemos que entender lo que es un deducible, para poder entender la diferencia entre cada uno, lo que es un deducible, un coseguro o un copago, y lo que es el deducible, pues tenemos que el deducible va a ser el porcentaje de que una persona va a pagar al año, después de que, antes que su periodo empiece. Un ejemplo puede ser, tú tienes un deducible de $3,000 y para que tú puedas, tu seguro pueda, por decirlo así de una manera, estar activo, se va a dividir entre ciertas porciones por cada vez que tú vayas al médico. Cada vez que tú vayas al médico se va a ir dividiendo en porcentajes estos $3,000 hasta que llegues a cumplir todo o pagues todo el deducible. Lo que es un copago. El copago nos va a ayudar a pagar, es lo que nosotros pagamos al momento de una visita médica, un ejemplo, o lo que pagamos, un pequeño porcentaje de lo que nosotros pagamos al momento de recibir nuestras medicinas. Esto no va en consideración a lo que es el deducible, o sea, no va a ayudar o no va a quitar que el deducible se haga menos. Y tenemos lo que es el coseguro, que el coseguro, en otras palabras, se aplica más a lo que son hospitalizaciones. Usted va a pagar un porcentaje del bill total, de la cuenta total de lo que es una hospitalización. Next.
So the private plans that we carry in the marketplace are CareFirst, United Healthcare, and Kaiser. United Healthcare was added last year, so they're fairly new. They were here a couple years ago, but they left and decided to come back. So now we have one more option for the private plans.
Para las opciones que tenemos para los nuevos, para los clientes, son tres opciones. Tenemos Care First, United Healthcare, que se agregó el año pasado recientemente, y si contamos también con Kaiser Permanente. Next.
Okay, so the MCOs, that stands for Managed Care Organization, are an MCO, I'm sorry, manages your health plan for you. In Maryland, we do have 9 MCOs to choose from, and the MCOs are managed by Health Choice. So they assist consumers with the plan selection. So this only applies to Medicaid, and the options for the MCOs are Aetna, Care First, Jai Medical, Kaiser Permanente, Maryland Physicians Care, MedStar Family Choice, Priority Partners, United Healthcare, and WellPoint, formerly known as Amerigroup.
¿Qué es una MCO o una organización de atención administrativa? La organización de atención administrativa es la que va a manejar tu plan médico. En el estado de Maryland tenemos 9 organizaciones de atención administrativas de donde escoger. Y las que tenemos que son participantes, estas trabajan exclusivamente con Medicaid, estas nueve organizaciones, que tenemos lo que es Aetna, Care First, Yale Medical System, tenemos también el Kaiser Permanente, Maryland Physicians, MedStar Family, Priority Partners, United Healthcare, and WellPoint, anteriormente conocido como Amerigroup.
Okay, we're here to help. Melissa.
Estamos acá para ayudarlos.
Next. Okay, how can we help? So we're here to help in enrollment support. Our navigators are adapted to safely provide support from the comfort of your home. We are over the phone. Navigators are standing by to provide one-on-one support and answer any questions through our call center. We are also online. And in person, navigators are available to see consumers in several sites across the county. To see the list of our sites, you can visit www.pgchealthconnect.org/get-help to learn more of our locations and hours.
Tenemos diferentes maneras de proporcionar soporte o ayuda a las personas que quieran buscar un seguro médico. A nuestros navegadores se han adaptado para brindarle una ayuda sin que corra pues un riesgo desde la comunidad de su casa, y el tipo de ayuda disponible que está puede ser por teléfono. Los navegadores siempre van a estar a la espera para poderles brindar el apoyo personalizado y poder responder todas las preguntas que ustedes tengan. También pueden hacer una aplicación por medio de internet. Los navegadores van a estar disponibles en línea para acompañarlo durante el proceso por alguna consulta o alguna confusión que se pueda tener, y pues todo se va a hacer por medio del proceso de inscripción, se va a hacer por medio de una computadora. Y también tenemos las opciones en persona de diferentes alrededor del condado. Hay diferentes oficinas donde una persona puede acudir en persona, o también para poder obtener más información podemos visitar la página de www.pghealthconnect.org/get-help para poder obtener más información de las horas y de las ubicaciones. Next.
Okay, we sincerely thank you for joining us. Prince George's Health Connect thanks you. please reach out to us for health insurance assistance at our call centers, PGC Health Connect. The main call center is 301-927-4500. And we also have another call center at 240-719-2167, Monday through Friday from 8:30 to 4. And we also answer phones through our partners, CASA, Multilingual Health Hotline, in Spanish and in English. Phone number is 301-270-8432, and in French, English, 240-270-1318, and they're open Monday through Friday from 9 to 4 as well.
El Condado de Prince George les agradece mucho por su atención y estamos acá para asistirlos. Tenemos diferentes medios donde nos pueden localizar directamente por medio de PG Health Connect. Nuestra línea directa es el 301-927-4500 y también tenemos una línea adicional al que nos pueden contactar, que es el 240-719-2167. Estamos disponibles de lunes a viernes de las 8:30 de la mañana hasta las 4 de la tarde. También nos pueden localizar o buscar asistencia por medio de casa. Tenemos servicios ya sea en español y en inglés, en diferentes también lenguas. El número de teléfono para servicios en español y en inglés es el 301-270-8432 y estamos disponibles de los lunes a viernes desde las 9 de la mañana hasta las 4 de la tarde.
Next. Okay, any questions? We have the answers.
Great. Well, thank you both for the wonderful information that really gives us a sense of what's available and what's possible, and also ways we can connect to get more information through your navigators. So the first question we've gotten in from Kathleen is, where can immigrant families in which no one has documents go for medical services, urgent care, eye exams, neurological exams, etc.?
So we provide a list of health centers across Maryland that can help with preventative care for sliding fee scale or lower costs. There are also additional programs such as Kaiser Care for Kids and also the CHAT program from CASA that assists immigrant families that don't have any documents. So those are the resources that we have.
Great, thank you. La próxima pregunta dice, buenas noches, disculpe, una pregunta, somos una familia de 3 niños y 2 adultos y podemos aplicar o calificar para el seguro. Somos migrantes sin papeles, sin nada. So similar question, family that doesn't have legal documentation at the moment, and what are their options? We'll go ahead and get that link for you. I'm going to have to adjust the screen share in order to do that, but I'll put that link in the chat for you. And perhaps we could answer that in Spanish for folks.
Melissa.
Sí, hay diferentes organizaciones donde se puede buscar esta ayuda para personas que en el momento no tienen un estatus migratorio. Tenemos un programa que no es directamente con nosotros, pero puede buscar asistencia, puede ser por medio de casa. También hay un programa que es para asistencia para niños y también está el programa por medio de Kaiser, que es un programa privado directamente con ellos.
We can provide yes, we can provide the links to the appropriate entities that assist with those programs.
Nosotros podemos proveerle la lista de las diferentes organizaciones que pueden ayudarle en estos casos.
Okay. So keep the questions coming, and we'll get to them. We've got a little bit left with our time together. So one of the questions I'd like to ask you both is, the Maryland and Prince George's County have particularly been really strong with getting community members enrolled with health insurance, but we're still needing to enroll a lot more younger people. Can you talk a bit about some of the barriers that exist there for younger adults and why it's really important for them to get enrolled?
Yes, so Maryland Health Connection, along with PGC Health Connect, is targeting younger adults to get them enrolled. Barriers such as just not knowing, thinking that they're still on their parents' health plan is one. Many other barriers that could hinder them getting health coverage do exist, and there are a lot of them, to be truthful. But that's why we're trying to get our flyers out there, where we have a lot of promotions going on in different, the movie theaters. We have events that we did in the movie theaters and the radio stations, just to get people informed, because some of these, barriers we don't know. Maybe they just they're not familiar with the system. Maybe they just moved here. It could be a lot of other things that could be happening.
La barrera para acercarnos a los adultos jóvenes, pues puede ser muy extensa. Puede haber diferentes motivos, por cual puede ser una de las razones, puede ser porque todavía no tienen conocimiento todavía de cómo trabaja el sistema, o tal vez están en los planes de los padres y no se han orientado, no han buscado la información suficiente para salir de los planes de los padres y buscar su propio plan. Pueden haber muchas barreras, infinidades de barreras pues que todavía no conocemos, pero tratamos de llegar a todas las personas, proveer informaciones por diferentes medios, haciendo eventos. Recientemente tuvimos eventos dentro de lo que son los cines para promover y dar información y dar educación a las personas que necesiten esa asistencia médica.
Thank you. We have another question here in Spanish from Kimberly. Buenas tardes, tengo una pregunta. Yo soy residente, pero mi niña no aún está en proceso. ¿Cómo puedo hacer yo para poder aplicar?
La aplicación sería para usted o para la niña. Pues ahí tendríamos que ver para quién es directamente la aplicación. Si es para la mamá y usted tiene sus documentos, tiene su estatus migratorio, tiene su tarjeta de residencia y su seguro social, podríamos empezar con usted. Empezando una aplicación, y mientras esperamos que su hija tenga los documentos necesarios, podemos incluirla y agregarla a la aplicación una vez que se tengan todos los documentos, pero le podemos proveer más información y le podemos orientar y darle la educación. Nos puede, como diremos anteriormente.
Can I just translate a little piece of that? Just, yes, everybody that needs assistance, even if you don't know your immigration status, please give us a call. We're here to help. That main line is, again, 301-927-4500. Any questions?
Another question I'd like to throw out is pertaining to people who are maybe going through a job change, or maybe going from being a student to starting a job. Let's say you're on your parents' insurance, you turn 26, and then you're starting a job in 6 months. Can you go to PGC Health Connect to get coverage for that interim period, even if you know you're going to have employer insurance in a few months?
Of course, yes, everybody is welcome. It doesn't matter the situation. We go off what's currently happening and not what will happen in the future. So yes, of course, and anybody's welcome to come and apply, and we will definitely get them started. And if anything changes, they'll just have to inform us, and then we'll go from there.
Nicholas, could you ask the questions in Spanish, please?
Oh boy. Ah, la pregunta es que si uno va a tener cambio de estatus, como ser estudiante y después vas a empezar trabajo o algo por así, y si tienes algunos meses sin seguro, ¿uno puede obtener seguro con PGC Health Connect o hay que esperar hasta que estás con trabajo?
No, perfectamente puede hacer la aplicación sin ningún problema. Nosotros nos basamos en el presente, porque no sabemos qué es lo que va a pasar en el futuro. Entonces, si ellos no tienen una cobertura o quieren salir de los planes, la cobertura de los padres, si quieren aplicar por ellos mismos y eventualmente ellos van a agarrar un seguro médico por medio de su trabajo, mientras ese proceso está, ellos pueden aplicar con nosotros. Y una vez simplemente se hacen los cambios necesarios cuando eso se reporte.
Well, thank you. Another question for those of us who lived before the Affordable Care Act, pre-existing conditions, do those factor into the pricing at all anymore for insurance, or is that disregarded?
No, it's not factored. The only factors that go into choosing a private health plan is your income and household size. So any pre-existing condition is not factored in, which is good.
A very positive thing from the Affordable Care Act.
Yeah.
Cool. Well, if anyone else has questions, please let us know in the chat. We've got probably time for one or two more. I'd be happy to take them. And just to remind you of the important details here, and we'll give Melisa a chance to give it to you in Spanish too. But you only have a few days left to enroll for regular health insurance through PGC Health Connect during this open enrollment cycle. So the cycle is open until January 15th. And there's a special last chance enrollment event if you want some in-person help this Saturday, January 14th from 10 a.m. to 2 p.m. at Penn Station in District Heights. And I'll put the details in the chat for you. All are welcome, and there will be Dora prizes. So that's pretty cool. You can get health insurance and a Dora prize. That's better than just doing it online. And also navigators are on standby to enroll over the phone this weekend, including on Saturday from 10 a.m. to 2 p.m. And the phone numbers again are 301-927-4500, or also 240-719-2167. And you can also call through CASA at 301-270-8432. And navigators are available to help in English and Spanish and other languages, no matter what the need. So we'll give another call for questions here. And
can I say something else?
Yeah,
Sorry. All the people that were needing those lists for additional services, and that Melissa, if you can translate this, the health centers and the programs that I talked about, please give us a call. We have brochures that we can give out and the list of the contacts for the health centers. So just give us a call at the call center and we'll definitely help you out.
Para las personas que necesiten la información de los programas especiales que mencionamos anteriormente, por favor, comunicen con nosotros a los números ya mencionados para que podamos proveerles y brindarles la información y la educación necesaria para dónde dirigirse directamente.
Excellent. Well, before we wrap up, we just want to thank everyone for tuning in. Would also like to invite you and encourage you, if you ever have a question about services, about access to healthcare, health insurance, you can also contact the library. We have 19 branches throughout the county. We have bilingual English and Spanish call center called Ask Librarian and Biblioconsulta, open 7 days a week except for holidays. And we're happy to take your questions, and we can make sure that you get connected to the right organization like PGC Health Connect or one of our clinical partners like Mary's Center and many other organizations. So the library is also a one-stop shop where you can get online, you can do SNAP benefits applications, you can do your PGC Health Connect enrollment call with a navigator and such. And we have some private spaces available to all of our branches too, so that you can do various things. So we'd just love to invite Dora and Melisa to give us some closing advice and wisdom in the next few days as we all try and make sure that we and our neighbors and our friends and colleagues have the health insurance that will help them be healthy in the years to come.
Of course. So like I said before, any questions or any concerns, small or big, doesn't matter, reach out to us. Open enrollment is almost over, and we want to get everybody enrolled in that private health plan if you qualify, and or Medicaid. Please reach out to us in person, online. We can assist with applications over the phone. Any way that you need help, we're here to help. So even if you have general questions about health coverage, we're also here to help. So I just want to throw that out there, and we can't wait to hear from everybody.
A todos que estén interesados en adquirir una cobertura médica, no sientan temor en hacer una pregunta. Podremos decir, es una pregunta tonta, no hay pregunta tonta ni pregunta pequeña. Todas las preguntas van a ser respondidas, toda cualquier duda, les podemos brindar la educación, la información, y aunque uno pueda pensar de que tal vez no califica, a veces podemos quedar sorprendidos de decir, o sí calificaba y no lo sabía. Entonces, es bueno siempre y no tener la información correcta, y siempre buscar la información correcta. Entonces, estamos nosotros disponibles para ayudarlos. Solamente nos dan una llamada, tenemos opciones, y como se mencionó anteriormente, tenemos opciones ya sea en persona o por teléfono para poderlos asistir. Entonces, no tengan miedo, todo es confidencial, obviamente. Entonces, aquí no hay pregunta chiquita y no hay pregunta grande. Entonces, siéntanse en confianza.
Well, thank you, everyone. Thank you to PGC Health Connect and Dora and Melisa and Michelle Lassane, who's our wonderful colleague. Thank you for being a part of our community, and thank you for being with us tonight to learn about these really excellent resources that can collectively move us all forward in a positive way. And again, don't hesitate to contact PGC Health Connect or CASA or the library with truly any question that you might have, and we will connect you with the resource even beyond just health insurance access, because we are here to serve you and to make sure that you have the tools needed to succeed as members of our community. So thank you, everyone. Good night. Hope to see you again on a program soon or at one of our libraries, and happy hunting for health insurance.
Buenas noches a todos.
Bye.
Bye.
Bye.